Good morning, everyone. My name's Amy McDonald, and I'm the Research Evaluation and Learning Manager here at Small Steps, Big Changes. It's just gone 11:45, and it looks like we've got a fair few people in the room, so I will kick off the second of our breakout sessions, where I'm joined by my colleague Felicity Cullen, SSBC Senior Project Officer, Colin Spy, Blackpool Better Start Development Manager, Angie Lewis, Leap Knowledge Transfer Lead, Claire Littleford, Head of Research, Evaluation and Impact at A Better Start Southend, and Sarah Carson, Workforce and Learning Manager. And during this session, we'll be running through how we generate change amongst the workforce. We will share the programme learning from across the partnerships around bringing about change within workforce. We'll present an in-depth case study from Nottingham Small Steps, Big Changes, picking up on some of the information that Carla mentioned in the earlier directors conversation, with an emphasis on further inclusive practice. And the other ABS sites will also share their case studies as well. We'll have an emphasis on what we've learned and hopefully give you some practical tools to implement change in your local area. The workshop's going to share collective learning around how workforce can do things differently to support families. I think it's really important to acknowledge, as we've heard in the earlier sessions, the challenging context we're working in at the moment. We've had COVID-19 pandemic. We've also had a cost of living crisis, and our local families have increased needs. So we need to really be thinking about how we adapt our services and ensure that they remain relevant for families. Another key challenge that we're all sort of grappling with is around workforce shortages, and there are some key policy drivers that are trying to address this. But really, we're hoping to provide some practical examples of how we might also address capacity issues, how we might attract staff, retain them, and develop the workforce. Next slide, please. So the 5 ABS sites are all sort of very different in their makeup and the context that they work in geographically, but actually there are some really key themes that have come through, and I think probably you've heard some of them touched on as part of the directors conversation. The key themes that will support families is really sort of effective partnership working, and it's really important to remember that families are always sort of a central part of that partnership working. Alongside that, we need to have a partners or a partnership that has a shared vision and a common framework for working with families across both your universal and targeted services. It's really also important to know your local environment, and you would have heard some of that. You'll hear a lot more of that at the moment. Identify the strengths that exist within the local environment, build on those strengths, and they might be strengths that parents themselves have, strengths that exist within the workforce. And really think about the relationships and the skills that can be brought to those existing strengths and build on them. Again, quite a lot of discussion around evidence-informed approaches as part of the directors conversation. And again, for workforce and change, this is kind of key, but also thinking about how we adapt for our local environments and build on the evidence-informed approaches to make sure they're relevant for families. We need to be inclusive in our offer and also work towards having a workforce that is inclusive and represents the community that it serves. We'll also hear around ongoing investment, the importance of it, how important it is to continue to support staff and build that local connection. In a resource strained environment, we'll hear examples of how we change hearts and minds and bring the workforce along with us to change behaviours and support better outcomes for families. If I can hand over to Fliss. Thanks, Fliss.
Thanks, Amy. Sorry for the slide jiggery. I think I got too trigger happy there. So as part of our case study, we're going to talk about our Think Dad strategy and some of the projects within that strategy. We produced an ambitious strategy for fathers in Nottingham City to feel supported in their parenting role. And part of, well, the biggest part of us doing this was bringing dads and the workforce along that journey with us as those at the heart of delivery and supporting families. So this would require a change in practice, asking workforce to adopt father inclusion in a holistic way, whilst being mindful that the workforce are also users of the service. So we started by consulting with our fathers, so that in the outset we were including the people we were trying to implement the change to in the heart of what we were doing. So this helped us to identify local gaps and where we needed to prioritise, recognising the importance of the evidence and the national guidance, but also looking at the local context. So we spoke directly to those at the receiving end of services, and then we could then use that knowledge to provide the workforce with the resources they need to build trusting relationships with those they serve. So we did that through a range of telephone interviews, focus groups, online survey, partnering with Quorum, the majority of sessions which were facilitated by a male researcher. So the aim was to obtain an insight into the lived experience of dads. So our key findings from that fathers generally spoke positively of local services and that they met the needs of their baby and mum, but they expressed a wish to be included and valued in those services rather than having specific services for men. So that's about our local context, and that may be different elsewhere. So it's really important to ask those questions to understand where your focus needs to be. There was a theme of not knowing where to go for information, using sources of information that weren't evidence-based. So clearly there was a lot of work to do to meet the priorities in terms of supporting fathers. And we were going to rely heavily on the workforce to be able to do that. Providing the workforce with the skills to include fathers and give them what they need, be confident by giving them knowledge about subjects that matter to dads, to share and provide fathers with evidence-based information. And interestingly, our Nottingham dads asked to be included in those existing services rather than having father-only provisions. So then our strategy was therefore to embed father inclusive practices into the systems that already existed. So this is a quick snapshot of some of the things we've done. So we wanted to work with local fathers and Nottingham City Early Years Services to improve support for fathers, and that would include sharing good practice, as well as producing resources and tools to help services improve their work. So using a creative and solution-focused approach to project design and development, whilst encouraging progressive change. So you can see that running through the thread of the strategy is fathers themselves and how lived experience can break down some of the barriers that might exist. But in all those projects, workforce were going to be our key drivers. You can also see that there's smaller projects that are raising the awareness and profile of father inclusion, so really changing the landscape in which workforce is seeing themselves shifting in. So where something like training, for example, is really important, there's other activities that work together to help spread that message and make change in different ways. One thing that we'll go into is how we've committed to creative ways in which to be inclusive and how that's manifested in workforce behaviour change, meaning that you don't always have to go directly to the workforce, particularly where there's capacity issues, but that you can enhance, flex, adapt the world they're working in to support them better and create those improvements. Following an evaluation of the strategy, it highlighted some fragmentation. So we had lots of good work going on in different parts of the system. So we've tried to embed our work into a toolkit as a host for those different elements that worked, to knit them together as a working packages services can pick up and use to become father friendly, and part of our service standards are part of that. So we'll discuss that a bit later on. So one of our projects was our Father's Information Pack, or our Dad's Pack as it's locally known, which is a co-produced pack that was designed following that consultation to address that identified gap of fathers needing evidence-based information and an easy place to be able to access that. So we distributed it to midwifery and health visiting colleagues for them to share in their antenatal contacts so that dads got that information in pregnancy. And it's been distributed widely throughout the community. And by ensuring that the dads got the information in the pregnancy stage, it meant that they could take the pack along on their parenting journey with them. But as I said, whilst doing that, we were also needing to take the workforce along that journey with us. You know, we could give the workforce the book and they're going to say, well, why do I need to give that out? So we wanted to start to kind of give them the confidence to be able to start conversations with dads. One of the things Workforce told us was that they didn't have confidence to talk to men. They didn't know what they were supposed to talk to dads about, what was important to dads, what information they should share. So the pack provided a way for them to do that. And so we provided them with Workforce posters that with the 3 kind of key things so they can start valuing dads. So they weren't just giving the pack out, that they were starting a conversation whilst they were doing that. And that may be seen very kind of simple, but it was a way we could help scaffold the Workforce to start embedding that culture in their practice and let dads know that they're part of the process, they're part of the intervention that's being delivered. So our dad's pack evaluation was overall really positive, and fathers spoke highly of the information that they'd been given. But more than that, from a Workforce point of view, we got a benefit that we didn't expect, was that the Workforce told us that the pack acted as a tool in helping them break down the barriers with dads, start those conversations and giving them the confidence to start talking to dads about their parenting journey, because they could use the pack, go through the chapters, and impart that knowledge and start those further conversations with families. So it created a talking point for professionals to start that conversation, therefore increasing their confidence overall and starting to change their practice. We've also done training, and we continue to deliver training, and you'll get the links to that in the chat later on. I'm not going to focus on the training because Colin's got some amazing training from Blackpool that he's going to share with you, but I just wanted to focus on our journey of the training. And when we first started, we started engaging dads training, and we were telling people how to engage dads. Well, how do you engage dads? And what we've developed over time is the why. So why are the Workforce that are coming to the training going to do what you're asking them to do with all the other demands that they've got within their service? So focusing on what is the incentive, what is the buy-in, what's going to get them to do what you're asking them to do. So we provide lived experience videos, and really sharing dads' stories, showing dads as humans that need their support. So we're relying on changing the Workforce hearts and minds, particularly in that sort of complex working environment with staffing issues. We wanted to demonstrate how father inclusion can support their practice, make things better for them and their families, and respond to the challenges Workforce were telling us they face. So we included information on safe sleeping, safeguarding child development. So really giving the Workforce tools that they can then go and have that conversation with dad. And where their practice is going to be most impactful. So that's a mix of evidence base with knowledge about the local community and the voices of local lived experience experts, so that practitioners can see how integral that work is to their everyday practice, and that the fathers can be a source of support and scaffolding for mother and child, as well as an individual in their own right. So when you're wanting to create change or improvement, you need to understand the why and how you're going to incentivize people to make that change. So one of our other projects was our recliner chairs project. So we funded recliner chairs in the labour suite and postnatal wards in our local maternity unit. And this was part of the local hospital trust's policy around fathers being included in maternity services. And the policy was stagnant because they didn't have the resources to be able to do that, but also because there was a lot of Workforce resistance around having fathers overnight on wards. So we implemented the recliner chairs, and this was really, a passionate individual that really wanted this policy to work, and she pushed ahead with it, reassured the Workforce, and took them along on the journey with her. So with the recliner chairs in place, the purpose was that partners would be able to stay overnight with the birthing mother, and help kind of improve that experience for the family as a whole. So the recliner chair evaluation, again, it was really positive. We went from 54% of fathers or close partners being able to stay overnight in 2018 to 86% with the introduction of the recliner chairs, which was, a significant change, and is really a testament to the staff as well, using that tool and going with it. So despite the resistance, the policy was really implemented in earnest. And partners and families gave really positive feedback about the project on its own. But again, we ended up with that extra benefit that the staff now welcome partners onto the ward. They felt it improved their experience, and on the whole, were really taking it on board. So you can see how a tangible resource, when integrated well into the service, can bring about that buy-in, provide incentives to workforce to change their mindset around the idea that you're bringing forward. And they really saw the benefits for families, and then were able to really harness that into their practice. So changing their hearts and minds around that kind of culture shift. And we've had really positive achievements from that. And another local trust has gone on to copy that project and implement it in their own setting. So as I said earlier, we were doing loads of really good projects, and we evaluated the strategy, and we needed a more unified approach. So all the good bits of work that were being done were quite fragmented across the system. So we identified challenges within that evaluation as well, of engaging senior leadership in the cause and the movement for change that was being created. It was really a ground-up approach. We had loads of passionate champions of the work, within workforce, and within families, but we weren't able to make that change at a higher level. So we had a conference where we kind of were able to renew that zest and energy for the project, and then we followed that up with the toolkit and father-friendly service standards. So we've taken all the best bits of all the work we've done, and we've put it into a toolkit that services can use to become father-friendly. So it's just really important when you're thinking about engaging workforce in behaviour change that they do need that support from their organisation and from a strategic level to be able to do that safely, to feel valued in doing it. And if you're giving the workforce information, but then they can't use that new knowledge, there's a risk it's going to get lost. So you can train somebody, but if without that senior leadership engagement, they're going to become disengaged, disillusioned, and they're still going to do really great work within their own practice, but they're going to feel limited in terms of what they can do outside of their own practice. So you're going to end up with pockets of good practice, but not a consistent approach across the board. So the conference brought together experts in the field, and we've worked with some really passionate experts from academia that are willing to come and give their time and their knowledge and expertise for little or no cost because they're really passionate about the subject. So go and find the people that are in the space that you're in, and and get them involved. Don't work in a sort of insular way. So we provided the father-friendly service standards, which are part of the toolkit, and that we developed from all that learning after the conference, so that kind of zest and energy from the conference wasn't lost. It could then be put into something practical. So the father-friendly service standards are a culmination of all our learning, really, and also kind of wanting to take what the workforce were telling us and give them a structure that could make them feel supported to do the work that they wanted to do. So the biggest takeaway from me in all of this is that it is a journey. You're not going to, when you start out, you might think it's going to look like something, and it might end up looking like something completely different, but there's something really rich in that. And you can end up with outcomes or outputs that you didn't think you were going to. So go along that journey with energy. Don't give up. And we wouldn't have got to the toolkit and the service standards phase had we not tried and tested all those other elements along the way. And the toolkit provides the things that worked, but that need to be knitted together to create change. So you can't just do one thing. You can't just put some training in. You have to think about all the different elements and where your energies need to go. So, and it is really important to have strategic engagement, but I want to also say that if you want to implement a change, it's really important to remain strongly connected to your workforce and families, as without them, the work won't continue. So don't lose sight of the fact that they're what you're doing it for, and serve them in the best way possible by listening, responding to their needs, being flexible. So the service standards are a result of that, the result of listening to the challenges people face and trying to provide that tool as a scaffold for them to further develop the work. And you can have a great product, but if it doesn't serve them, it won't work. So you can develop something, but it's going to fall flat if it's not, if you've not had that kind of co-production. So we're hoping that the service standards, we're piloting them now. We're hoping that they will then be kind of picked up and implemented across Nottingham City, so that we can have a father-friendly Nottingham City. Where there have been challenges, we've tried to find solutions with the workforces, as like I said at the beginning, you know, remembering the workforce also receive these services, so working with them to overcome them. What we've created is a movement for change, so centred around workforce and fathers, so that really ground up approach, leaving a legacy of tools for passionate minds to continue to champion the work and feed father inclusion up the system. So any questions, pop them in the chat and we'll answer them at the end. And I'm going to hand over to Colin from Blackpool.
Thanks, Fliss. I'm going to give you a bit of a whistle-stop tour of one of our projects that I put together, following on from the dad's work. We have, and similar to Claire was talking about in the main session earlier, some of the work we look at in Blackpool is around that culture change. So within the dads, we're really looking at the whole marginalisation and bias that dads face in systems and trying to change that culture of the way services view dads. So we set up the third part of our workforce training in dads was an engaging dad session, and we started off in the first phase of co-production by running 6 sessions with some dads to build an understanding of them through the storytelling of their experiences. And we did these in evenings and in community sessions to reduce some barriers and make a bit more of an informal approach for some dads. We had 5 dads involved in those formal sessions, but we also gathered verbal feedback from a very wide range of contacts out in the community that both those dads and our workers captured the voice of. And initial feedback, the dads were positive about the experience of telling stories, and the relationships they were building between the facilitators and the dads themselves shouldn't be underestimated, because that helped create layers of support in the sessions and also afterwards, because they then were able to form social groups and peer groups. And dads were able to enable change in themselves through those conversations as the ideas flowed between them. This then meant that we could move on to the second phase of actually co-designing the training. We had through 3 meetings, dads actually designed the training package themselves, and it really wasn't about a standard stand up and talk and give some instruction and PowerPoint sessions. It was about the dads actually standing up and telling their stories of what they'd lived through working with services, and for those professionals to then try and unpick that and then look at their stories of working with dads to see if they could start to look at what they'd seen in a different lens now, with a different understanding of reasons and whys and wherefores. Dads also shared a preference to deliver training in the heart of where their lived experiences were, rather than doing it in formal professional environments. They felt it'd affect their confidence and everything like that. So they wanted to do it in community venues so people could actually see where they were talking about in their stories. And then in the final delivery phase, those dads actually delivered alongside the professionals as well, to help with the impact, because the professionals found that the stories coming from the dads themselves was so much more impactful, and that really helped create the value of working together with those dads over time as they were involved in it. And in 9 training sessions, we delivered to 81 bookings, with some really full sessions in between, which took lessons from. But the feedback that we learned at the end was the appreciation of having dad's voice in the room was couldn't be overvalued enough. And the feedback from professionals wasn't necessarily about focusing on how much they were changing their practice, it was how much they were changing their thinking, and thinking about where was dad in the relationship with the family, where was dad in the process of the work they were doing, and creating dad-friendly work environments and really setting the scene and the landscape for what needed to happen. So that's a whistle-stop tour of an activity we did there. Anybody got any questions, please feel free to ask at the end, and I'll hand over to Angie.
Thanks, Colin. Thank you. Yeah, hi everyone. My name's Ange Howard-Lewis and I'm from LEAP, so Lambeth Early Action Partnership. And I'm going to be giving you an overview of our pair service. So moving away from father's inclusion, but keeping a focus on workforce development. So our pair service is a specialist parent-infant relationship service, and it's part of LEAP and also South London and Maudsley NHS Foundation Trust. It's based within Lambeth CAMS, so Child and Adolescent Mental Health Services, and it offers direct clinical interventions, including parent and infant psychotherapy, video-based interventions, and parent-baby groups to families. And the service also works with Lambeth Early Years workforce to build the knowledge and skills to respond to infant mental health needs and to support parent-infant relationships. So this includes workforce training, as well as consultations and reflective supervision to help build the skills and capacity of staff to support infant mental health in their roles. So reflective supervision, it's the most sustained support PAIRS provides for local practitioners, such as parenting programme practitioners, children's centre staff, midwives and health visitors. And it's often delivered to pairs or small groups of practitioners who are working together on delivering attachment-based interventions. So reflective supervision is the shared exploration of the emotional content of infant and family work as expressed in relationships between parents and infants, parents and practitioners, and supervisors and practitioners. So it's not clinical supervision, therapy, or purely safeguarding consultation. And it focuses on experiences, thoughts, and feelings directly connected with the work. Reflective supervision is characterised by active listening and thoughtful questioning by both parties. And the role of the supervisor is to help the supervisee to answer her own questions and provide the support and knowledge necessary to guide decision making. And I've got a quote here which I thought really nicely summarises the impact which reflective supervision can have on practitioners. So one local Lambeth practitioner said, "I look forward to supervision every week as a way to help me process what has happened in the session and why things went the way they did, good or challenging. It gives me space to offload and gain perspective so that I don't need to carry the group with me for the rest of the week. It also helps to remind me that just because there is rupture doesn't mean there can't be repair, and that helps to boost my confidence as a facilitator." So just linking back to the key learnings mentioned earlier in the presentation, I feel this type of workforce development activity supports the creation of a shared vision and common framework for working with families by embedding a shared understanding of how to support infant mental health and parent-infant relationships across professional boundaries. And it also ensures that the local workforce are given ongoing support and an opportunity for connection through the provision of protected spaces to discuss their experiences in providing support to families. And just before I end, I wanted to say that as part of Infant Mental Health Awareness Week this week, LEAP are hosting a webinar which will be sharing learnings from an external evaluation of the PAIRS service this Wednesday between 12:30 and 1:30. So please do join if you're free, and we're going to put the registration link in the chat. And now I'll be passing over to Claire from A Better Start Southend.
Thanks very much, Angie. I'm Claire Littleford, Head of Research Evaluation and Impact at A Better Start Southend. I wanted to give a brief snapshot of our strengths-based approach to working with families in Southend. ABS has developed an approach to supporting families called Your Family, which is very much part of the legacy of ABSS here in Southend. The concept is of a friendly community that families can join. They may use it to find out information about local services or activities, or to meet other parents and get peer support on their parenting journey. Or they may decide to attend organised group sessions or workshops, for example, around different aspects of parenting. Or they may opt to get tailored support from the Your Family workers, which, depending on their needs and what they're looking for, could be quite in-depth support. So every family that engages with Your Family will have a conversation with one of the Your Family workers to identify the kind of interaction or support that the family is looking for. And the ethos of this is very much a strengths-based approach. Every family can do something right, and every family is good at something. Once what those things are have been recognised, that gives a place for the family and the worker to build from and for changes to be made from. So it's very much a partnership approach between the family and the workers. So the Your Family staff are able to give advice and signpost to support, but the family is very much in charge. That can sometimes feel like quite a risky approach for workers, but it's empowering for the family themselves. The Your Family staff are trained in a strengths-based approach, which is based on the family partnership model. So that's an asset-based model, which takes a trauma-informed approach through partnership working between the worker and the family. and a shared understanding of what those family strengths are. It's an approach that's been widely used in various settings in the NHS in particular, and here it's been adapted for a community setting. So the Your Family staff team have taken the manualised training and the approach as a whole, and they've adapted it to work in the community setting. So it's an evidence-based approach that uses those asset-based community development principles, but it also applies the experience and confidence of the workers themselves in their approach in applying that to our local context to make it work for families in Southend. And this is an approach that ABSS is keen to champion across the whole of our work in Southend. So it's this strengths-based approach to working with families. And this is an approach that we are promoting throughout the ABSS partnership with all the organisations that we work for, but also more broadly in Southend and across South East Essex as a whole. And the idea is around changing systems by sharing that strengths-based approach to working with families. So that puts families and children right at the centre of our thinking. And it's part of that wider asset-based community development approach that ties in with co-production and the centering of the voices of lived experience, particularly through things like our Parent Champion programme. So we have a workforce development programme that includes a series of in-person workshops and some webinars and some specific training for practitioners. It's about building capacity within that local workforce. But building capacity within the workforce also means building community capacity, because we're sharing that learning and building strengths with the families we work with, but also through the broader partnership approaches that we have with the other organisations we work with and with the community more generally. So this is shared learning that can really be applied by our workforce. And of course, our local workforce comes from the community that it works with as well. So it's all very much building towards that strengthening of the local community through the way that the work is done. So that's just a snapshot of what we're doing in Southend. So now I'll hand over to Sarah in Bradford. Thanks.
Okay, hi, thanks for that. So the story that we're sharing today focuses on our student placement initiative and our role in developing Bradford's future workforce. And this example focuses primarily on higher education and our work with the nursing and midwifery programmes at our local university and our role as a placement offer location for the students on those courses. It also showcases the development of the virtual live learning programme, which is a series of over 70 free online workshops we've delivered in recent years, focusing on the work and the impact of the projects and the initiatives we have supported. So this virtual live learning programme was initially developed to support the student placement offer during lockdown, and has actually grown into a really valuable resource for both student and workforce audiences across many sectors in Bradford and beyond. So our placement offer gives students direct access to the work and impact of Better Start Bradford projects, stakeholders and funded work, and also gives an introduction to all the very different areas of our work, including groups, projects, training and shadowing with our various teams at the Better Start Bradford in a variety of settings and locations. This placement programme is validated. It's an NMC accredited placement, which is part of the student professional accreditation requirements. And this accreditation is actually provided through our specialist staffing team. So to focus on the key learning themes, we've built effective partnerships with the university and local NHS as an NMC accredited quality placement provider for students in the district. We have contributed our knowledge of the local environment. Our student placement offer gives a really unique insight to the students across the broad opportunities in both health and voluntary and community sector. And we're supporting a workforce approach to career longevity and employment opportunities by showing the breadth and diversity of the very different roles that they can play throughout their career, recognising those retention and rates and those recruitment issues that are so prevalent prevalent so early on in many nursing and midwifery careers. And we've also used an evidence-informed approach. So by designing the placement and learning programme around the learning and impact from our Better Start projects, we've also been able to demonstrate the best practice approaches at a really critical point of their learning and embarkment on their professional careers. And then in relation to ongoing support and connections, the virtual live learning workshops have developed into a district-wide and beyond workforce offer. We regularly have public health professionals from across the world joining our free workshops for information and insight. We're providing free accessible sessions on topics from domestic violence and infant mental health right through to speech, language and communication and play. And it's provided a fantastic opportunity to share the work we've supported across Bradford. And I think in the chat, our current virtual live learning programme will be shared. So you're all very welcome to book on and join the sessions that we've got running at the moment. And then during this past year, this offer has also grown into the FE offer for education and early years students across the 3 main colleges in Bradford. And this all feeds into looking at the longevity of the work, where it goes after we're not here. And we're looking to embed this work into the curriculum planning and the course content for all these programmes for students going forward. So I'm really mindful of the time. Hopefully there's lots of questions for all of us, but I'll hand back to Fliss for the summary. Thank you.
Thank you very much. So hopefully you've got a good sense of some of our learning around workforce development, and pop questions in the chat. It'd be really good to have a discussion for the last 9 minutes. As a summary, ensure that voices of parents and professionals are at the core of your work, from planning to evaluation. Be adaptable and willing to change and redevelop. Be flexible, meet people where they are, both physically and mentally. Understand the environment and your local context, and empower people, recognising their strengths and igniting their passion, using that strength-based approach. So we want you to go out there and be ambitious. Don't give up. It is a journey. Invest in creative incentives that build confidence, trust and courage, and that doesn't always have to be monetary, and empower, like I said before, recognising people's strengths. Links to further training events will go in the chat, and all the information related to the projects will be sent out with the slides. But let's go to a Q&A. So have we got any questions?
We have, Fliss. Yeah, thanks very much. That's been a really good session. And like Fliss said, all the information will be available in the after event pack. And please do click on the links and get more information about the sites. But we've had a question come in here from Katie Mitchell. Thank you, Katie, asking about partnership working. What do you say are the barriers to doing this effectively, particularly across organisations? I don't know who wants to come in on that.
I can think of a few things. I'm going to guess from previous conversations, Felicity will probably follow me here. If I'm thinking about things like the dad's work that we've spoken about a bit here. I mean, the number one challenge with getting organisations talking to each other is just getting them in the same room to start with. The second one is where people are. If we think about the examples of the dads that we've been talking about, it's where they are in their culture of that problem, where they think about that issue, how far along they are. Is it a priority for them? Is it not? Do they actually have the resources in place to be able to address that issue? And is there a willingness to do that? Now, we can find different levels of participation, motivation, and engagement, and willing, and all that at every stage, you know, right from the top to the bottom. They could all have very different ideas. So in terms of the dads, we've quite often found that in some of the work we've done with some services, we've started from the top and they filtered down the priority of putting dads on the radar, and indeed in other services. And the same with things like co-production. And then in other services, we found that we've gone with the workforce at the bottom in their training, and they're changing what they do on the ground and the way they think about it. So actually they're putting the pressure on above them to say, actually, we need to change our practices. And there's a big difference between how you feel about the practice and the system. And they're two different things, and they're quite hard to navigate sometimes, because some systems, if you think about it in terms of fathers are difficult because they just don't capture data on dads. It wasn't in health visiting books for quite a long time on maternity. There's legal positions that don't do it. And then I think somebody put in the chat as well about a lack of men in the workforce. Now that can be an issue because there's no role models there for somebody to follow, or even for a child to be in a session and then go home and say, "Oh, there was a man reading a story." So that story goes home with them as well. So it is okay for them to be okay. So that culture isn't just about the service; it can be about actual the community as well, and the cultures they have and they feel about things. In terms of other areas, is thinking about co-production as well and changing the mindset on the ground, because it can be quite hard to give up that control sometimes, and actually making it okay to know that you're not the expert, actually the person who's been through those systems and experienced them on the receiving end is the expert, and sometimes you need to listen to them. And that's a bit, I think, that we spoke about being brave earlier and sticking with it and not giving up just because they're not telling us what we want to hear. And sometimes it's a case of, are they wrong, or do we just not like hearing it? And sometimes we have to go into those conversations that we don't like hearing.
Yeah. So there's a couple of things there, Colin, isn't there? And so that issue with getting strategic leadership involved and the kind of partners at the kind of higher levels of that structure, where you're in a very reactive environment, so they're just reacting to national guidance that comes out, and if your particular project or work isn't in that, it's not a priority for them. So you can feel like you're banging a head against a brick wall a little bit because it's not being embedded properly. And we get services that really want the dad's pack, but they don't want to do everything else around it because they're under time pressures. And it's tricky to get them on the same page. And I think in partnership working, when everyone's got different agendas, and you're trying to kind of slot your agenda into those places, it can be quite tricky. I think you've got to be savvy about it. So you've got to get the partners on board by thinking about where your idea, program, project fits within their structures and priorities. So thinking about dads in the best start strategy. So thinking about the strategies that they're working it with and where your project fits within that. Also, there's a bit about impact, isn't there? And I know we spoke about this, Colin. There's a bit about evidencing. This is why you need to do it, because there's evidence of that impact. So whether that's economic impact or or you've got an evaluation that something really works, then people are going to be much more likely to come around the table and talk about it.